Everyone. I would first like to express my sincere gratitude for giving me your precious time, your ears, and attention in this very important conference. My association with this conference is just because I am part of the subject, a mother of two victims. I therefore thank you so much for this opportunity. For us parents and patients of rare disease, this conference is not just another gathering. It presents to us something more valuable, a hope. The coming together of a great mind like yours will continue help raising the agenda of rare disease to its deserved attention. We are optimistic that joining together our voices will be heard and attended. My name is Sharifa Mbarak, a mother to two rare disease-affected children, Nasreen and Ali. Nasreen is no more. She gave up early in fighting this hard battle and passed away at the age of 3 in 2016. Ali, who has survived to 10 years so far, has been through untold hardship that many of us have never seen. Both Ali and Nasreen have been victims of double-edged tragedy. First, nature has picked them among those few to live with rare disease, and second, they are victims of geography for being born in a country where knowledge, understanding, and appreciation of their plight is very little. The story of our children is not unique to them. It's the story of many other children in Tanzania living with rare disease and family that takes care of them. Lack of diagnosis. We've not been successful to get right diagnosis of early so far. Also, one experience is common across developing countries. There's little appreciation about rare disease, and data are not adequately available. As a result, rare disease receive no or limited mention in health policies, and if acknowledged, little is done to translate into specific services and interventions in health system and supportive system like health insurance and education. Being the mother of two rare disease children in the past 10 years, I have observed the following. Healthcare and social support services that exist are designed for patients with common disease, with little or no regard to needs of patients with rare disease. Lack of diagnosis results in patients and families being denied necessary services in hospitals, schools, and the community, and lack of family counseling and assistance programs on a short-term basis to help families coping with a rare disease. That's not all. For most people living with a rare disease, as well as their family members or caregivers, the reality of daily life includes any combination of the following: collecting and taking medicines, attending appointments, participating in physical therapy, using special equipment, and accessing various social and community support services and respite care. In absence of dedicated health support and rare disease children, parents and guardians become paramedic by default. Those altogether sum up to a full-time unpaid job. For some of us with a career life, the honors can be unbearable, as apart from working with the government, I've dedicated my efforts in founding Ali Kimara Rare Disease Foundation, which was established in 2016, and I am the chairperson of the foundation. The vision of the foundation is to become the voice for rare disease affected children in Tanzania. In order to reach our mission, we aim to achieve the following goals: increasing visibility of rare disease in Tanzania and at global level, fighting stigma and get rid of the taboo within families of rare disease children, extending and share knowledge about rare disease and their unmet needs, promoting international multi-stakeholder collaboration and action for rare disease, and aligning rare disease as a global priority in public health research, and medical and social care policies. We know so far there are no treatment for rare disease. We believe, however, that is not a reason good enough to condemn rare disease patients to fate. The least we should do is to assure them dignity, care, and support. Yes, we cannot cure, but we should at least be able to help patients to overcome related complications. This can be met if we assure patients access and affordability of tailored health services. This, I believe, our government is ready to do it, as how we all witnessed in 2020 and 2021 during Rare Disease Day commemorations with the president of that when the president of the Tanzania, Honorable Samia Suluhu Hassan, by then she was the Vice President of Tanzania, promised to act on this agenda and also to be the voice of the voiceless. The commemoration was jointly prepared by Ali Kimara Rare Disease Foundation and Tanzania Society for Human Genetics and brought together the cross-section of participants from victims and families of rare disease, political leadership, policymakers, from health and education fraternity, practitioners, religious leaders, private hospitals, and insurance companies. Well, from that commemoration, both governments committed their readiness to work on the recommendation aired by the children with rare disease, caretakers, and professionals to see a possibility to establish a coordination unit within the Ministry of Health for Rare Disease, to consider undertake a census and to establish a register of children with rare disease to start with, to explore the best ways to ensure access and affordability to healthcare for children with rare disease, including possibility to waive costs and a provision of health insurance, to support and encourage research in human genetics in Tanzania and rare disease in specific, work with Ali Kimara Rare Disease Foundation and Tanzania Society of Human Genetics to promote public education and knowledge about rare disease. Policy and the laws should be established or reviewed in order to ensure that children or people living with rare disease are provided with their constitutional rights and important services, including the right to education in a conducive environment by taking into consideration of their condition. And I would love to say that now the government or through Ministry of Education is recognizing these children and they recognize homeschooling system. Ali Kimara is the first child to be registered to get his education at home, and now they are reviewing the guidelines and policies of education to include these children. It's a good thing. Well, from that, I've decided to rise the challenge and become a voice and a champion for kids with rare disease. I decided to see the responsibility to advocate for their right to education, medical treatment, care, attention, and equal opportunity within the country. I thought and I believe my own experience and healing journey is rare and may help to educate others to overcome the trauma and huge stigma surrounding the kids with rare disease. I want to tell the world that we, the parents and caregivers, do really value our children. We hold a belief that children with rare disease are special and need equal rights, love, support, recognition, and education like other children. And it's time to take action for people living with rare disease to have equal opportunities to realize their potential because it's possible, it's doable, it is achievable. My dears, I would love to tell you all that rare is not rare as you think. In fact, rare is not scarce, rare is not infrequent, rare is not remote. Rare is precious, rare is many, rare is strong, and rare is proud. I believe Ali Kimaro Rare Disease Foundation and Tanzania Society of Human Genetics will keep on working together to reframe what it means to be rare. Last but not least, we appreciate so much and thank you all for listening.